In this video, we will look at supporting people who have a PEG and look at some of the swallowing risks. By the end of the session, you will be able to identify why some people are nil by mouth, what is meant by enteral feeding, and swallowing risks for people who are nil by mouth. For some people with high risks, an unsafe swallow means other long-term options, such as having a PEG tube, so their food and drink can go directly into their stomach. A PEG, or percutaneous endoscopic gastrostomy, is a tube which allows the person to be fed directly into their stomach without the need to eat or drink through their mouth. This can reduce the risks of food going down the wrong way. The person can have the correct number of calories and nutrition given in this way. This will be agreed with the dietitian. Sometimes this is done using a pump, which can be set to ensure that the person receives a certain amount of feed each hour. Other people have a bolus feed. This is when their feed is given in set amounts, usually via gravity, directly into the PEG tube. A person with a PEG can carry their feed and PEG pump in a backpack, allowing them to continue to live independently. If a person uses a wheelchair, this can be attached to their chair. By slowing the amount of feed given per hour, any risks associated with acid reflux or regurgitation may be reduced. If a PEG feed is given at a slower rate, at any given time there should be less feed in the stomach, so if the person regurgitates or vomits, only a smaller amount of undigested feed should come up. Some people with a PEG can still have small tasters of food, but others will be nil by mouth. This decision will be made by the dietitian and speech and language therapist, alongside the person, their family, and other key professionals, in line with the person's swallowing risk. It is very important to always follow the advice given. If a person can have tasters and food via their PEG, the taster foods or drink are usually in small amounts. There will be a care plan in place to support the person to have tasters safely. This will be in line with advice from the speech and language therapist or dietitian. The person will also have their drinks and medication via their PEG tube to reduce swallowing risks. As people vary whether they are totally nil by mouth or can have some food or drink orally through their mouth, it's very important to always follow the advice which is in place in order to keep the person safe. To make sure that the person gets the right amount of food to remain healthy and hydrated, this amount will be advised by the dietitian and will depend on the person's size and weight. What are the risks for the person who is nil by mouth? A person who is nil by mouth and takes all their food, drink and medication via a PEG can still have swallowing risks. It's important to remember secretions such as saliva and mucus in the mouth can be swallowed, leading to aspiration. As previously discussed, it's important that the person is supported to keep their mouth clean, even though they might not be eating and drinking. This is especially important if the person is not eating or drinking orally, as it will be harder for them to keep their mouth moist and clear of secretions. Some people with high aspiration risks may need a suction machine to help reduce the risk of secretions going down the wrong way. Some people will have advice from the physiotherapist about chest exercises or postural drainage to help clear the lungs. Positioning for people who have their food, drink and medication via their PEG is very important. They should always be sat upright when having something through their PEG. If the person is poorly and has their medication or a drink through their PEG on their bed, they should always be sat upright with pillows or by using an automatic or profiling bed to sit them in an upright position. If someone has a PEG fitted, they will need to have a break of 30 minutes from their last food, drink or medication via their PEG before they are moved. For example, from their wheelchair to their bed if they require assistance. This time will be advised by a dietitian and may vary depending on their level of swallowing risk. Always check the person's care plan. Acid reflux, as we saw in video 4, can also put a person at risk of reflux going down the wrong way and going onto the lungs, causing an infection even if the person doesn't eat or drink through their mouth. This is because the food can be regurgitated from the stomach and enter the mouth, with the risk it can be swallowed and go down the wrong way. Stomach acid can burn, and if this happens, it can cause a very serious chest infection and damage to the lungs. You should now be able to identify why some people are nil by mouth, what is meant by enteral feeding, and swallowing risks for people who are nil by mouth.